Despite all of these benefits, there is a challenge, and the challenge that we're going to talk about today is resistance development, and that can really limit long-term effectiveness of the targeted therapies that we're prescribing for our patients in clinic. So the first concept to talk about today with regards to resistance is what, meaning what type of resistance might a patient experience with regards to being on targeted therapy. And so there is this concept of primary resistance. And so primary resistance is where you have resistance from the very start of targeted therapy. So if you look at this graph here on the right, you can see that this is tumor burden, meaning how much cancer is present at the start of being diagnosed with cancer. And you can see for this patient experience that unfortunately, despite starting treatment, the tumor burden, the amount of cancer continues to rise. And that's even at the start of targeted therapy. And so we call that primary resistance. Then there's a concept of acquired resistance. And so if you notice here, right at the beginning of diagnosis of cancer, there's a high tumor burden. There's a high level of cancer that's present in that patient. And what you see is that when they start targeted therapy, that level of cancer in the body starts to go down. And that's the response that we want. And so most patients will have this initial response, but then they'll still have what we call minimal residual disease, which means that there's still a very small amount of cancer that's present, maybe not even seen on the scans, and that continues to persist. And ultimately, at a certain time point, we start to see that there is that level of clinical detection, that amount of cancer that's present on the scans that we can see, and then it starts to rise, and we call that acquired resistance. So this is going to be really the main bulk of focus of our discussion today. So how do we know if targeted therapy is working in your case, is still working? Well, one is definitely symptoms. That's why we spend a lot of time with our patients at the bedside. We ask, how are you feeling? We encourage you to discuss any symptoms that you're experiencing while you're getting treated. And then we rely on our scans, our imaging test, and that's really our gold standard. Well, another thing that we think about when we're talking about clinical trials, we've talked about it a lot today. The reason why we found all of these targeted therapies is because there were patients and their loved ones many years ago who heard about a promising drug that was being studied on a clinical trial. And they courageously and very selflessly stepped up to say, I want to be a part of this to see, one, is it going to help my case? And second, is it going to help patients who are facing a similar condition in the future? And we track different endpoints on clinical trials to see, is this drug working and is it still working? And so one of the clinical endpoints that we use often to see, is the targeted therapy still working, controlling the disease without it getting worse, is called progression-free survival, or PFS. And so I won't talk a lot about this today, but I really focus on patient education. And if you're interested in learning more about clinical trials, what they mean, how you might be able to understand them as a patient, I'd encourage you to check out this article that's in Future Oncology that I helped co-author, and it really explains endpoints in patient-friendly language.